Good morning, guys. I'm Gordon Barfield. I am a clinical manager here at Overjet AI. Been a practicing orthodontist for 12 years and another 16 years practicing comprehensive dentistry. I really have the pleasure of introducing to you this morning Dr. Keith Baines from Jersey City, New Jersey. Keith has graciously agreed to give us a few minutes of his time before he sees a busy day of clinical patients today and talk about his journey with Overjet AI in his dental practice. Keith, good morning.
Hey, good morning, Gordon.
Really glad to have you here.
That's
Tell us a little bit
here.
about your history, your practice, and how you came to make the decision to put Overjet AI and AI in general into your practice.
Sure. So I've been practicing full-time as a general dentist in Jersey City, New Jersey. I practice with my brother. We have a pretty much an insurance-driven bread and butter practice: crowns, fillings, single implants, removable, all the basic general dentistry.
So nuts and bolts dentistry.
Yeah. And about 2 years ago, we partnered with Dental 365. And a year ago, they brought to us Overjet. Prior to that, I never even heard of AI in dentistry. And it was new to me until they presented it. And it's been a big asset to our practice.
That's amazing. So you actually didn't make a proactive decision to bring in AI. It was brought in for you.
I never even heard of it until I went to our annual symposium and they presented it to us.
Incredible. And now that you've been using it for a while, walk me through sort of how that decision felt on the front end by Dental 365, and then how it felt in your mind, and has that changed at all?
As soon as I saw it, I knew that it would be a benefit to our practice, specifically because we do so much general dentistry and restorative. Not only from the ability to diagnose cases more efficiently, more accurately, but also to help educate patients and help explain to them what we're seeing, why we're recommending treatment, and why we think they should take action for their dental health.
Sure. Keith, I know that you brought some specific case studies with you today. So let's walk through those. This is number one, and we're looking at a left premolar bite wing, of course. And as a dentist for 32 years, I would look at that and not really think too much about it, right? We see some existing restorations, a root canal and a crown on 12. And if I look carefully for another moment or so, I might think about something on the distal tooth number 20, but there's still some doubt in my mind. Walk me through this.
Absolutely. This is a typical kind of x-ray where I think in a busy practice, maybe we look at it quickly and go, oh, everything's okay, we'll see you next time. If we look at it long enough, certainly we could see something on the distal of number 20, but different dentists, you're going to have different opinions, different monitors, different x-ray sensors. And I think if you advance to the next slide, we'll see what Overjet shows. And certainly Overjet's going to highlight the distal of number 20, that there's caries on that area of the tooth.
100%. And so the side by side here, and we can highlight it out. And all of a sudden, this becomes important for patient education, because being able to highlight that lesion for the patient who can't see it at all on the x-ray on the left-hand side goes into the patient education piece. Prior
to Overjet, I would also try to educate patients by looking at the x-ray. And I'm pretty sure that pointing to a slight different tone gray triangle and saying this is a cavity to the patient, they're probably going, yes, doc, I trust you, but they're probably don't see anything that we want to show them. For sure. So Keith, our first clinical photo here, and this is initial exploration on that lesion. When you open these and we initially look at them, what is the sense that you get? What is your feeling? I'm always surprised at the extent of the tooth decay that is there. Just from the Overjet and the way that the x-ray presents itself, it looks very innocuous, very conservative. But once we start excavating that decay, we find that it's actually much more extensive than it looks on the x-ray. For sure. And here you are with your clinical series, including your final result on the right. Keith, I noticed that you're utilizing a slot preparation on these.
And that's in alignment with the conservative recommendations by ADA for caries management. Can you talk to that for just a moment?
Certainly. With any kind of dental work, we want to preserve enamel, we want to preserve dentin, and I want to keep the patient's healthy tooth structure intact as long as possible. I look at every tooth as if it was my own, what would I want to do? And I try to keep everything as conservative as possible in order to preserve that tooth structure for the patient.
And how is AI helping you in that particular part of the decision-making process, Keith, and the assessment?
Certainly, we're able to intervene earlier and more confidently. It removes a lot of the subjectiveness away from our diagnosis and lets us convey to the patient what the situation is accurately and have better case acceptance. I think patients are more eager when they understand what's going on in their mouth.
100%. I love that. So here we're looking at the second case that you brought us, Keith. And again, another premolar bite wing here, the right side. Just walk us through what we're looking at here.
So there's definitely a lot of interproximal caries on this patient. The reason I sent this slide over to you is this is the type of patient where either they've been outside of the practice for many years and they're coming back with a lot of dental needs, or it's a patient that moves into town, says, I've been seeing my childhood dentist for the past 20 years. My teeth are great. I haven't had a cavity in 10 years. And now as the new dentist, I'm in the uncomfortable position of saying that their last family dentist may not have been treating everything that's there or may not have been seeing everything.
So that patient trust factor rears its head again.
Trust factor is huge. And I don't know if those patients are fabricating a story because they're embarrassed that they haven't been to the dentist in 10 years. But I constantly hear the story of, I've been going to the dentist regularly, everything is great. And then it's always a little bit awkward trying to carefully explain what the real condition is. And having Overjet, having this slide objectively showing where tooth decay is very important in that trust factor and in the education of the patient.
For sure. And so in this series on the right-hand side, we're going to focus in on a couple teeth, I think.
Let's focus, I think, on the bottom right on this slide, on 28 and 29. So with this slide, just like the previous one, the decay is deeper than we may see from the x-ray. And by the preparation design, we're able to keep it very conservative and preserve a lot of tooth structure.
I love that. So the AI is actually helping us on the assessment of the quantitative nature of the caries, how large the caries is, and then our planning for what our ultimate intervention is going to be restoratively. Absolutely.
And rarely am I surprised when it relates to the Overjet overlay on the x-ray. If it looks a certain way, it's consistent patient to patient, the way Overjet analyzes the x-ray.
Beautiful work, by the way. I love it. Outstanding restorative work. So you would say that overall artificial intelligence in your restorative practice has helped you be more clinically efficient, more objective, and increase trust factor with your restorative patients.
Absolutely. And again, education is a big part of our practice and explaining to patients, and Overjet greatly helps that for us.
Fantastic, Keith. One last passing thought, if we could. I'm always curious as to patient response to new technologies. I remember putting lots of new technologies in my practice, and I always was curious about how they would be received. Can you speak to any comments that your patients have offered up on AI in general when they see the annotations, when they see the education part?
Absolutely. Patients, I mean, we all hear AI every day, whether it's something related to the internet, related to music, related to healthcare. And patients, I don't think they know it exists in dentistry, but when they see it, they're very impressed, and they know they're in a practice that's on the cutting edge of dentistry.
Amazing. Keith, thank you so much for joining us this morning. We really do appreciate your time. I know you need to go get to a busy schedule of patients today, including a lot of restorative dentistry. So thank you again. We'd love to have you back.
Thank you, Gordon. It's my pleasure. Nice talking to you.
Again, for anybody that wants more information on Overjet AI or AI in dentistry in general, we'll go ahead and drop a QR code here for you, and you can feel free to reach out to us. Thank you for viewing.